For information and entertainment purposes only, not intended to be construed as medical advice. Consult your provider.
Are there certain lifestyle changes that someone can make to reduce the risk and severity of periodontal disease?
Yep. If you're a smoker, you can do what you can to stop. That'll help. There's a trend right now with mouth taping that allows you to be able to not sleep with your mouth open. And so what that does is it prevents the mouth from drying out, and that's actually better for the gum. So if you're a mouth breather, try to use some tape and see if you can eliminate some of that mouth breathing. So there's that trend right now. Some of the other things, like as far as what you can do at home, stay away from like a alcohol-based mouth rinse. That's going to dry the mouth out some more. Try to stay away from some of the vices that you know.
Sugar.
Yeah. and even those that are over-consuming alcohol, that's going to dry out the tissues. You know, there's things that if you're more prone to it, like at least be aware of it.
Mm-hmm. Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. You have such a beautiful smile.
Oh, you're so kind,
You
Selah.
do.
I mean, after many trips to the dentist, do my teeth look like this, right? I know.
So hard.
But I'm glad they look really good.
Yeah,
right?
It's worth it. I mean, it looks amazing.
It is. And, as a mom, I want to make sure that I am just practicing really good dental hygiene so that I can pass that on to my son so that he never has to experience some of the things I've had to go through, right? Now, some of it is genetic.
Well, that's what I was wondering, because
Yeah.
I had a lot of cavities as a kid.
Oh, did you eat a lot of candy?
No, not at all. My parents were like crazy health nuts.
Huh.
But my son does too. One of my sons, I should say.
Yeah.
So I wonder what the genetic component, because one
Me
does,
too.
one doesn't.
I wonder
know.
what that is, too.
Yes. And also, like, again, the genetic thing, half
Yeah.
of my siblings had cavities and half didn't. So
That is weird.
I don't know.
Like some of my siblings, same way. I wonder what it is. Like, is it a recessive trait or is it a dominant trait, right?
Yeah.
Because it's not like we don't regularly brush our teeth. It's not like I don't floss
Exactly.
and do all the things I'm supposed to do.
Yes.
It's just that every now and then things take a turn that are not very fun.
Not that we
for
don't
me.
want
Yeah.
to deal with. And also gum disease. That I know
yeah.
is preventable. Right?
Periodontal disease, I think, is the official medical term for it.
Yes.
And I think some people have it and don't even know that they have gum
I think so
disease.
too.
Yeah.
Well, I do think I had it once in
Really?
pregnancy because it's prevalent in pregnancy.
Oh,
I think. Listen to me acting like I'm.
Yeah, you're
I'm the dentist now.
The dentist.
We're gonna ask
Yeah.
all of these questions to our guest.
Our guest today is Dr. Brian Harris.
Yes.
Yeah. Known as the Smile Creator, Confidence Builder, and also educator.
I love that. Dr. Brian Harris is one of the nation's leading experts in adhesive dentistry, cosmetic dentistry, and creating the ultimate patient experience.
I love that.
Yeah.
He is a 2005 graduate of the University of the Pacific School of Dentistry and a practicing dentist in Phoenix, Arizona.
Yes, he is the creator of the Smile virtual software platform, which allows doctors to attract and treat more complex cases in their practice. That sounds fascinating.
So I guess he's going to tell us what are good habits for us to continue on. I mean, we're like, ugh, I hate to use this phrase, but middle age.
I guess so.
Right? But like
I'm in denial.
But also like the good practices and habits that we can instill in our kids from an early age,
Yes.
hopefully preventing gum disease, periodontal disease, and just how to have a beautiful smile for as long as
right.
possible. Let's bring in Dr. Brian Harris. Come join us. Let's
Come
chat.
on in. Hello, Dr. Harris. Welcome to the show.
So glad to have you, Dr. Harris.
Yes, Dr. Brian Harris, you are part of the Harris Family Dentistry line. There's 4 of you, right? 4 brothers that are
Yes.
all part of. They're all part of the dental industry, and your dad.
Yep.
Do you want to tell us a little bit about that?
Yeah, I will. There's actually a fifth, I guess called a sixth. So I'll give the full backstory. But
Yeah, tell us.
Hey.
my dad was a dentist, and so I grew up around that. You know, it's kind of all I ever knew, and we saw him grow his practice. We saw him kind of go through this transformation in the early '90s when cosmetic dentistry like first started happening. And so I think that was when all of us boys were like, oh, this is actually like kind of a cool profession, not just like a dentist, you know. And so my brother Eric followed in his footsteps. And then I was 2 years behind Eric in dental school. And then Scott was 2 years behind me. And then Cameron owns a dental lab. He was the smart one of the group. And he owns the lab that makes all the night guards and retainers.
Oh, wow.
And then I got married and my father-in-law's a dentist.
No.
Yeah,
Of course.
Way.
Of
Are you
course.
serious? So
And
funny.
unintentional,
Wow.
but yeah, I think it's an amazing profession. I think it's one of those professions that's, you know, when you're around it growing up, you kind of see the good in it, and so it makes you more excited to want to be a part of it.
Wow. I bet your mom was so proud. I mean, what a successful, good parenting.
Yeah, no, it's been fun. It's been a great thing to share in common as a family.
So you're known as the smile creator. What does that mean?
Yeah, so within dentistry, you know, there's different kind of little niches within dentistry, and one of those obviously is cosmetic dentistry, and we do a lot of that at our practice. So we've got a great like family practice with a focus in cosmetics, and but cosmetics isn't just porcelain veneers. It isn't just like changing smiles. A lot of it is how we take care of the overall mouth.
Dental
And,
health.
Yeah.
Yeah.
And that falls in line with like what the gums look like, you know, what as crazy as it sounds, but like what the breath smells like what the
Like, you're fine. You're
Okay.
I stepped back a little bit too myself.
I'm like, uh-oh.
But you know, so I think when we talk about creating smiles, it's not just like changing smiles. It's like how do we help people take what they have and make it look amazing and feel healthy at the same time.
Yeah.
And we're talking about periodontal disease, but in layman's terms, what is periodontal disease, Dr. Harris?
It's a term that gets used, and it's kind of scary when you hear it. I think a lot
Yeah.
of that's just like what the media has done, but ultimately, it's just this idea that you've got teeth that sit within inside of bone in your mouth, and then you've got this mouth that's like it's like the entry to the body for everything.
Right.
And so it's filled with bacteria. You know, the teeth get overused. We grind on the teeth. We can overwork the teeth, and so the periodontal side of things is like it's the gums and the bone that support the teeth.
Right.
So it's really like we call it a lot of times the foundation. It's the most important part of the smile. If the foundation's not strong, then it can't support the teeth, and the teeth is what we normally see within the smile.
Oof.
Is periodontal disease different from gingivitis?
It is. It's been known and it's talked often, you know, about the idea that gingivitis is like the first step, and then as it progresses, it goes to periodontal disease. But you can gingivitis is common. Gingivitis you get it teenage years when you have braces. You get it like during hormonal changes. You see it a lot in pregnancy. You see, so gingivitis is more. A lot of times it's like a direct reflection of what the body's going through.
Oh, okay.
Periodontal disease is a little bit different because you can't really see it. It happens all below the gums and the bone.
Oh.
And so you may have an issue going on and you're not even aware
Okay.
of
I
it.
thought I had periodontal during pregnancy, but I think now I had gingivitis.
What is gingivitis?
So gingivitis is inflammation of the gums. So
Like they're red and bleeding a little.
they bleed easier and it's you know those hormonal changes, those body changes will show up in the gums. And so gingivitis is more, the best way to think of it is like, hey, if you have gingivitis, it's reversible. It's like you need to just get through the pregnancy and let the body balance, and then it'll get back to normal, or you need to get those braces off, or sometimes like you just need to do a better job of home care at home, and that will calm down the inflammation.
I see.
And then periodontal disease, that's more like,
It's not reversible?
it's, once the bone is gone, like you can't get it back. And even with the gums, once the gums recede, there's certain procedures where you can bring them back, but the rule is that the gums follow the bone. So once you lose the bone, the gums kind of follow that. It's hard to get back.
How does this happen over time?
So two big components. One is genetic. So there's certain populations that are more prone to gum disease, and there's certain populations that are more prone to cavities. And it's kind of funny. You'll see different populations where, you know, in different races where very low incidence of of periodontal disease, but then like lots of cavities. And the other way around, where it's like I've never had a cavity, but then there's bone loss. So a lot of it is genetic. A lot of it is just our own makeup of our bodies and things that are fully outside of our control. And then the other part of it is like things that are in our control. So you can get genetic predisposition to have it, but then you can also have like, if you haven't had teeth cleaned in like 5, 6, 8, 10 years, and now there's buildup, and then because that buildup then causes bone loss. So there's kind of two sides to the equation.
So like poor oral hygiene,
Yeah.
plaque buildup. What are some of the other risk factors that can cause periodontal disease?
Yes, it starts poor oral hygiene, then it's the plaque, and then the plaque becomes like the harder calculus, and then it's like on the teeth, but then it gets underneath the gums, and you can brush 5 times a day, and you're not gonna get it.
What about like things like smoking, drinking?
All those things kind of add to making the situation worse. And it's kind of one of those things that as long as there's an awareness there and you catch it early, you can reverse it. And it's a matter of just maintaining it. So I shouldn't say reverse. Reverse isn't the best term because you can't get it back.
Right.
But you can reverse the process and stop it.
Stop.
Oh,
it.
that's
okay.
good.
Yeah.
What are some of the signs and symptoms of periodontal disease?
The biggest signs are receding of the gums, or you start to see spaces happening at the tops of the teeth, which is also just a sign of natural aging too.
Right.
So you can't get that confused, but those are the main signs. Is the buildup on the teeth. You can get pain in those areas, and then sometimes you can, when it gets severe, you can even smell it more on somebody's breath.
Like halitosis,
Yeah.
bad breath? Really?
Yeah. So there's different types. So there's one type of halitosis, like right now, talking for this long, like I may have bad breath just because I've been talking and I haven't drinking anything for a little bit. So there's that, but then there's also the halitosis of like bacteria under the gums, around this, and that's a different type.
Wow.
So
So next time I smell someone's bad breath, I'll say, I think you have gum disease.
So what are some of the treatment options for periodontal disease that are non-surgical?
Yeah, so the surgical versus non-surgical. Non-surgical is like when you catch it early. I mean, it really is as simple as go to the dentist, let them clean the teeth. Common sense would say like, hey, if it's been 5 years, 10 years since you've been, it's normal for them to have to do what they call deep cleaning. And then you hear that term used often. It's normal, like, hey, they've got to go underneath the gums. It's not surgical, but they got to get down and get all that out. And that's for your benefit, because if they don't, then that can't be reversed. So go get a deep cleaning. That you kind of have to do that before anything else. Then after that, then you maintain it with different mouth rinses, different at-home care routines. When it gets really severe, then that's when sometimes they'll go in and do surgical procedures to kind of create less space around the teeth and to tighten up the gums. Believe it or not, we do less and less of that nowadays. Things are just so much more conservative nowadays than before. There's lasers that can be used to fix things now.
Wow.
Yeah.
That's amazing.
You mentioned rinses and things. Are there what types of different rinses or I guess liquids would a dentist prescribe to someone to keep periodontal disease at bay?
Fluoride rinse or
Yeah, so the fluorides would be more, those are good at preventing like cavities.
cavities?
And, yeah.
Okay.
But the certain rinses, like there's a rinse that's like an antimicrobial rinse or even like an antibiotic rinse.
Oh.
When it gets really severe, the dentist can prescribe that you can use that rinses, some antibacterial stuff down inside the gums to rid that bacteria of those areas.
Okay.
And then just normal rinses. Some of the over-the-counter products that we use on a daily basis aren't necessarily good for the teeth because they have alcohol, which then dries out the gum tissues. So my advice is always find a good rinse that doesn't have alcohol for like
Okay.
early stage taking care of your gums. If it gets bad, then go with the dentist's recommendation. Go with like an antibiotic mouth rinse.
Okay.
Okay.
Wow. What are some of the consequences of untreated periodontal disease besides bad breath?
Yeah, but the biggest one is losing teeth. So sometimes we lose teeth because started as a cavity, got too big, turned into a big filling, then a big crown, and then it's like, I mean, it happens to almost everybody. Super common. Sometimes though, so much bone will be lost that the tooth becomes loose and then gets infected and has to come out. So I mean, the biggest thing you want to try to avoid is losing teeth because of loss of bone.
Oh.
That's the main thing with periodontal disease. Like the bad breath is like, it's a byproduct of that, but it's you don't want to lose teeth, but then also you don't want to have that kind of bacteria in the mouth and in the bloodstream, because that can lead to heart disease. That can lead to,
that's what I've heard. Alzheimer's.
Yep. There's a lot of studies happening right now that are tying, oral issues to some of these long-term chronic diseases.
Because the bacteria goes into your bloodstream and then
it passes the
brain or whatever. Oh my God.
Those sound like worst case scenarios.
Yeah, that's
Let's
true.
prevent all
Let's
that.
prevent all
Let's
that.
do as much as we can to prevent that. Yeah.
Exactly.
And they are. And I think sometimes it can be used as almost a scare tactic. Right?
Oh, it definitely scared me.
Oh yeah. But there's some validity to that,
Sure.
Yeah, for sure.
How important is it that you as a dentist work with someone's physician if you are seeing signs of periodontal disease?
I think it depends on how aggressive it is and depends on their overall health. So if I see somebody that is high risk, that has heart issues, or I can read the medications and I see, there's a lot of heart issues, or they recently had open heart surgery, it's like, let's make sure we're aligned so that we're not doing any invasive surgery that can cause other heart issues. If it's somebody that's generally healthy, usually it's something that we can manage within the practice without having to get like an outside specialist involved. But it's always going to come down to just their overall health status in general.
Okay. Are there emotional and social effects of periodontal disease?
Yeah, I think being able to smile with confidence and show all your teeth has a huge impact on how you feel about yourself, like how you interact with others. Like I think there's a huge part of that. I think it's just a matter of and let's just like talk openly and honestly for a minute.
Please.
Yeah.
You can't, there's certain things you just can't avoid, right? And there's some people that if they have this predisposition to it, they could have amazing home care, oral care, they have awesome hygiene, and it's just going to happen to them.
Wow.
And so it's not something that people should feel shameful of or feel embarrassed about. It's like, okay, you own it just like you would if like there's high incidence of diabetes or heart disease in your family. It's like, okay, that's part of who I am, and I need to do these things to make sure that we minimize that.
Right.
And I think where I see people get into trouble is they do feel embarrassed, they do nothing, they let it go too long, and then it becomes a big issue.
Yeah, there's a lot of shame associated with dental problems. People feel I even was embarrassed to tell you I had a lot of cavities when I was little.
Well, but also the anxiety and fear of just going to the dentist and hearing all the things that need to happen. I feel like, so here's something that my dentist office does, and let me know if yours does this as well. When you first get to the dentist office, they take your blood pressure.
Oh.
Every single
Really
time.
smart.
Well, I mean, another thing is they're on the second floor, so you have to climb stairs to get there. And I'm always like, can we just wait a second, please? Can we wait? Let my heart rate go down. But no, there is a real anxiety and a real palpable fear that a lot of people have when it comes to seeing a dentist.
Yes, definitely.
I think some of that fear comes from the fact that it is a vulnerable space.
For sure.
It can be painful having
Yeah.
things done. I think a lot of that comes from like trust too. I think all of us have been in that situation where you're sitting in the chair and you're like, okay, what is going to happen here? How much is it going to cost? What are they going to tell me about all the things that are broken that need to be fixed? And so, yeah, I think that the dentist has a real responsibility of just like being as open and as direct and as honest as possible with patients, but also like always doing what's best for them. And so I think that some of that anxiety can be fixed just by finding that right person that you trust. In side conversations, you've both now talked about your dentist, and it sounds like you have somebody that you trust, and I think that's super, super important of maintaining that. I think where it's hard is when dentist retires or you move, like finding somebody new is
When
terrible.
you move, it's the hardest. The place that I go to, what I love most about them is that everyone, from the person working at the front desk to the dental assistants to the hygienists to the dentists themselves, it feels like a collaborative effort, but a
That's
very
really cool.
warm and welcoming environment.
Yeah.
And they are always there to listen when I'm like, okay, guys, I'm scared. What are we doing today? You know, like, well, what are you scared
Right.
about? Well, let's talk about that. You
Right,
know, it's not a let's hurry up and get you in so we can get the next person in, you know?
Right. That's such
Yeah.
a good point. I
Yes,
never
you
thought
really
about
do have
that.
to find the right environment for you.
Dental family.
Yeah, it
Kinda
does
like
feel
the
that
Harris
way.
family.
For sure.
Yeah.
Yeah, I've been going to them now almost 10 years. So.
Oh,
But
wow.
that what you just explained, that is what everybody should be looking for.
Right.
Because now you know, like they're there to serve you. You're just not there to serve the business.
For the
Right.
Does that make
business.
sense?
Yeah.
They're there to serve you. And it's one thing my dad taught us at an early age in practice is like, just take really good care of people and like the success naturally follows.
Of course.
And I think that's missing a lot in business today.
Absolutely. Are there strategies for coping with periodontal disease and treatment as far as what we were just talking about, finding the support and communicating? It sounds like obviously communicating with the dental team is the most important thing.
Yeah, I think that's the most important. And then sometimes, like working with the specialist, like we have amazing specialists we work with where when it gets to a point where it's like, you know, it's getting a little bit more progressive, that's all they do is work with patients that have,
really?
that have periodontitis. So what's called a periodontist, their whole focus is bone and gums that support teeth.
I didn't know that.
So sometimes that's important because then who you're working with, that's all they do is work with people in a similar situation. So it can almost feel a little bit less threatening or less embarrassing because you're at a specialist. That's all they do.
I've been told I very soon have to go to a periodontist to get gum grafting.
Oh,
Gum grafting it's a tricky one. So
Okay.
I have my own opinions on it. I think
Tell us.
well, there's incidences where it's just necessary. You have to do it. You know, it's also one of those things that I think we as patients taking care of our own mouths and just being aware, like you can prevent a lot of that also.
Oh.
Like if you have an area, if you just take a quick eval yourself in the mirror and can see like, wow, how come that gum looks way higher on this side than the other side? Oh, it's
Okay.
because I'm right-handed and naturally it's easier to brush this way. So just like some self-awareness of like, okay, let's just brush softer on that area and just watching that, you can prevent a lot of that.
Okay.
When grafting does need to be done, like sometimes it does need to be done. And then that's where I'd say periodontist is great for that because they can go in and do it in the right way, have it look nice, have it blend really well.
Okay.
but if you are at home and you are dealing with periodontal disease or you've been told you're approaching that, what are some of the practices that you can use to prevent and even manage gum disease?
Yeah, water pick is like any type of water pick, water flosser. There's a lot of brands on the market now.
Okay.
Those are great because they get down inside the gums, which sometimes you just can't do with floss.
Right.
So always try to floss if you can. If you're not going to floss, then it's just the reality. A lot of people may not want to. Go with some sort of water flosser that will get down in there. If you don't want to make a mess on your sink, they have even ones you can buy that hook onto your shower.
Oh.
Yeah,
That's a good idea.
I actually installed one in my shower. My wife made me take it down because it looked just so tacky. Like this big, yeah, because it was this big cord, this big flosser, like in a nice shower.
Oh my gosh.
And I actually, she didn't make me take it down. I think after a while I was like,
I don't like this.
I don't need to take this down. But water flossers are great because it gets down inside the gums. And then just like a routine. You know, think about we spend a lot of time on like skincare routines and like the time and effort. Just a little bit more effort on your oral care routine would make a big difference.
Oh wow.
How long should you be brushing your teeth and taking care of your teeth every day?
Yeah, I think, the rule of thumb is like 2 minutes of brushing morning and night. I personally believe 2 times a day is sufficient. I don't think you have to brush during lunch. I don't think you have to overdo it. 2 times a day is sufficient. Flossing at least once a day is ideal. But it's also one of those things like if you can't meet the ideal, just do the best you can.
Do the best you can.
Yeah.
What about fluoride toothpaste? Is that only in regards to cavities?
Yeah, fluoride toothpaste. There is a debate on the whole fluoride topic.
Yeah.
Is it bad for you? Is it good for you? I feel like if it's not needed, if you're not super cavity prone and you don't need to have it, I feel like it's probably not necessary.
Okay.
But then you do have people that are cavity prone and you want to use a fluoridated toothpaste so that you can prevent those cavities. So it's kind of one of those, like, I think anything in excess is too much. If you don't need it, then there's great toothpaste out there that are more natural, that are great. But if you are cavity prone, then there is an upside.
And that will help with gum disease as
Yeah,
well?
it helps. Part of the issue is it's all part of the problem. If you get a cavity down by the gum line, and now we have to do a filling there, that's going to cause the gums to recede more. So it's all interconnected.
It's all connected. Yeah, that makes sense.
Are there certain lifestyle changes that someone can make to reduce the risk and severity of periodontal disease?
Yep. If you're a smoker, you can do what you can to stop. That'll or minimize it. That'll help. There's a trend right now with mouth taping that allows you to be able to not sleep with your mouth open. And so what that does is it prevents the mouth from drying out, and that's actually better for the gum. So if you're a mouth breather, try to use some tape and see if you can eliminate some of that mouth breathing. So there's that trend right now. Some of the other things, like as far as what you can do at home, stay away from like a alcohol-based mouth rinse. That's going to dry the mouth out some more.
Okay.
Just try to stay away from some of the vices that
Sugar.
and even in some those that are over consuming alcohol, that's going to dry out the tissues. There's things that if you're more prone to it, like, at least be aware of it. Treat it like you would any other disease. Like, if you're more prone to heart disease, then maybe stay away from some of the foods and higher cholesterol. You have to kind of look at it the same way.
Yeah, that makes sense. How do you know you're more prone to gum disease, though?
Look at parents, look at grandparents.
Okay.
See, do they have some sort of partial denture or denture? Like, a lot of times you'll see it in families. And you'll usually know if you're going regularly to the dentist, if they, when they do those silly measurements, like 3, 5, 4, when they count those out, that's just measuring pockets. They'll usually tell you, if things are getting more severe. It's usually not something that you're cruising along, you're seeing a dentist, you're good, and all of a sudden, like,
Boom.
gum disease. It kind of will sneak up on you over
Get the
time.
signs.
So it can be progressive,
Okay.
yeah. How do you cure gum disease without a dentist? I know there are probably limitations of home remedies, but how would you?
Yeah, there are. I would say this. If you could at least, so once it gets to actual gum disease, that means something's going on under the gums that you can't get to yourself. So I would say if you could at least get in and get a deeper cleaning done first in some way, then it's like it lets you kind of hit reset. Then you can do a lot more on your own at home.
Okay.
I'm a big fan of empowering people to do as much as they can at home. But that's one of those areas where it's like, hey, to even be able to do that, you got to at least start with getting the stuff under the gums out. Then you can do more on your own at home.
Okay. Are there other medicines or anything over the counter that people can do? You said rinses.
Yeah, there are some rinses. Most of the things that will really impact like what's happening under the gums are more by prescription only. Even the rinses, even like there's some antibiotics that can be placed underneath there. Most of that though is going to be done through a dentist.
So, what do you think of the homeopathic remedies like oil pulling? I've heard a lot about oil
I
pulling.
think hey, if it's better than not oil pulling.
Okay,
right?
right.
Like
it might do something.
Yeah, that's one of those where think about it. You're getting oil down in between. It's going to be, a different consistency than water. It's going to kind of push and pull. That stuff will clean things out for sure.
Oh, cool.
So I think anything you're willing to do at home is better than not doing anything.
Right.
But it's one of those areas in medicine that you're not going to necessarily be able to reverse it on your own. You may need some help to kind of start the process, and then you can focus on.
Then you could do your oil pulling.
Okay,
Makes
it is
sense.
time for Ask the Expert. This is when people who listen to the show have a chance to ask you, the expert, anonymously, so through us. So here's the first question. Is periodontal disease hereditary? If my parents had gum issues, am I doomed to get them too?
There is a genetic component. There is something to that because, in families, if your parents had a certain kind of bacteria that is going to cause gum disease, and just naturally, whether it's, as a child or sharing a drink or, some of that can get passed on. So, but it doesn't necessarily mean that because they had it, now you're going to have it too. It's no different to me than heart disease. If one of my, someone in my family line is super high cholesterol and died of a heart attack, that doesn't mean that I'm going to go down that same path if I can prevent some of the things earlier on.
Right.
Yeah,
that
that
makes
makes
sense.
sense.
This person asks, is gum disease contagious through kissing or sharing utensils with an infected person? I thought that
That's a
when
good
you
question.
said that last comment.
Yeah.
It is, and I know people don't like to hear that, and people don't like to hear that, but
We want the truth.
Uh-huh. We can handle it. We can handle it.
Yeah.
it is. And I think where it becomes more of an issue of let's say, you and your partner, like let's say one really cares and they're going to the dentist and now they've had to have a deeper cleaning done and have this other way. It's just really important that the other person is open to doing that too. Otherwise, what happens is you're working really hard over a year to get this done, and if your partner's not, then you're not going to get to the place where you want to be.
Or just don't kiss.
Yeah, just don't kiss.
Or
Yeah.
just don't kiss.
So yes, it can be, but it's also one of those things that, there's so many, because you kiss somebody one time that had periodontal, it doesn't mean like now you're going to have periodontal.
Oh, okay.
It's just something that it's like, it
could be.
Yeah, if you're involved with someone on a regular basis and you're trying to stay healthy over here, it's going to be harder to stay healthy, when there's that transmission bacteria.
Goodness.
Okay, this person wants to know, can periodontal disease be cured, or is it a lifelong condition that needs to be managed?
Yes and yes. I think it can be cured and that we can stop it. It's a hard thing to reverse that bone loss, to reverse the gum recession. So you can't really fix and reverse it, but we have tons and tons of patients that have had periodontal disease that have gone through the process. It's arrested, it's stopped, and now we're just maintaining them at that level. So it's something that can be stopped. It's something that you always are going to have an awareness of, though, throughout your life to make sure that it doesn't start back up.
Doesn't recur.
Yeah.
That makes sense. How often should I get a periodontal cleaning if I've been treated for gum disease in the past?
That usually, it depends on how stable things are, but typically we see every 4 months. People that have had gum disease and been treated for it, every 4 months are coming for a cleaning.
And it's
Now,
a periodontal cleaning?
It's
in
what we
particular?
call like a periodontal maintenance cleaning. So the rule is kind of like if you have gingivitis, you're getting regular cleanings. If you have periodontal disease, gum disease, at some point you kind of shift over into this phase where it's like, okay, now it's a deeper cleaning and periodontal maintenance. Usually you don't go back over to just a regular cleaning within an office, like your dentist's office, because they kind of treat them separately. But like, let's say you move and you go to a new dentist and they assess everything and it looks really good, you might fall back into this category of like, okay, just regular cleanings and maintenance every 6 months.
Okay.
So it's kind of one of those, we try to treat it like, hey, if you've been there and you've had that, then we're going to put you on a little bit different protocol just to make, and it's not for our selfish benefit, it's just to make sure like that doesn't progress and
That you don't miss
you
anything.
don't get any worse.
Yeah, exactly.
This person wants to know, what is the difference between a periodontist, an endodontist, and an oral surgeon?
So endodontist is all nerves, root canals. They're working to save teeth. Okay. Periodontist is like gum, bones. They're the foundation. Oral surgeon is like taking teeth out, any type of surgical procedure where it's usually removing something or biopsying something. So that's the general terms. Where it gets confusing is with dental implants. So all three of those specialties do dental implants. So all three of them, more so the oral surgeon periodontist. Like if you need an implant, usually you're going to an oral surgeon or a periodontist.
Okay.
But nowadays, technology has advanced in such a massive way that a lot of dentists themselves like are doing those surgeries for their patients with super high success rates because it's, we just have really streamlined systems now. But that's the biggest thing is there's differentiators, but the one thing kind of everyone has in common is everyone's kind of in the game of replacing teeth.
Yeah.
Oh, well, that's good. Wow, this has been, I've learned so much today.
Me too. Are there any parting words of wisdom that you have for our audience, Dr. Harris?
Periodontal word.
Periodontal words.
I would say, that we live in a time where there's so much access to information and technology, and materials are advancing, medications are advancing, everything's getting more progressive and less invasive, and treating it more early on instead of waiting for it to become a problem. Like, if you know that this is something that you potentially could have an issue with, or you're on the fence, it's worth it to do the little stuff on the front end to mitigate some of the big stuff on the back end. And so it's just having an awareness of it, and being intentional about regular visits.
Wow.
And also, even more so, your home care. I'd much rather see somebody go to the dentist once a year and have an amazing home care routine than somebody who slacks at home and isn't doing anything but is going to the dentist 2 to 3 times a year. You know what I mean?
Mm-hmm.
I think so much of it's how we take care of ourselves at home.
That makes sense.
Thank you so much, Dr.
Yes,
Harris, for
thank
your
you, Dr.
time and for your insight and all this expert information. I think we
Yes.
all needed to hear this
Yeah,
today.
thank you so much.
Of course. Thank you for having me.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because of the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All product, service, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.